J&J has a partnership with Google, developing this robotics company for surgical. Why this type of partnership? Why did you see the value in teaming up with Google?
This is the next wave of innovation, where how do we take some of the same insights, the intuitiveness and understanding of what Google is doing, for example, with driverless cars, how do we think about that in surgery? So that we not only do it to assist surgery, but we actually improve the outcomes to help guide the surgeon of where they perhaps at some point, should leave more of a margin, where they shouldn't, be able to look at their statistics over time. So it creates a very different experience than what we could have even imagined a few years ago. And, we think at the end of the day, this is really going to transform the way that we do surgery around the world.
Are healthcare companies going to become tech companies, or is it going to be a matter of partnership?
Well, I think you cannot be the world or a world's leading healthcare company if you're not a healthcare technology company. Technology is ubiquitous. Let me give you a couple of examples. In pharma, when you think about the incredible power of the genome, when you think about the improved understanding that we now have in so many of those areas, we cannot do that if you don't have the strong database skills and analytics to bring that genome to life. Because fundamentally, it tends to be part mathematical problem, part biologic issue, part chemistry issue. And so bringing all that together requires the kind of data analytics and insights that if you don't have those skills, you cannot be at your best, you can't be most relevant. I had my hip replaced about 1.5 years ago, and I can say I feel better and stronger than I ever thought that I could have, but it's a static device. Going forward, how will the devices interact? How will they be more dynamic? How will they use sensing, visioning, new types of materials to be connected in new and exciting ways that we couldn't even imagine? And finally, in our consumer space, look, if you're not on the cutting edge of e-commerce and in some of these areas, you just won't be relevant, for example, to the millennial mom and others. So we clearly see ourselves as a healthcare technology company. And in some cases, we just don't have that technology. So we have to partner with the Googles, the Apples, the Microsofts, the IBMs of the world. In other cases, we try to bring that inside because it's inherently going to become part of what we do each and every day.
How then do you attract a millennial workforce and keep them kind of in this era where tech companies are very popular and we're seeing millennials move in that direction?
Sure. Well, there's a few things that we do that I think have really given us a great advantage in terms of attracting millennial talent. Now, I must say overall, I think we feel very good about what we're doing. And if we look at our attraction rates, our turnover rates, frankly, they're at least at par or better than what we see in other segments within the company. I think it starts with having a purpose. So our credo and having a value system and knowing that what you're doing when you come to work for Johnson & Johnson is you're helping people, patients, consumers live longer, healthier, and happier lives. In some cases, you might help cure multiple myeloma. You might help a patient get out of the hospital a day after having their knee or their hip replaced.